Welcome to the AWIP podcast. We're your hosts,
Jacob Lloyd.
and I'm Rae Smith. Here we focus on investigations and all things animal welfare related. We're bringing you in depth and conversations each week with animal welfare professionals from around the globe, so be sure to find us on LinkedIn, YouTube, and Spotify. To learn more about AWIP and our mission, check us out at awip.org.uk or at awipusa.org. I think this is going to be a really good episode. We have officially our very first vet on the show. So this I'm pumped
Exciting.
about this.
Yeah, this is super exciting.
A lot of people know this woman. She's got her own podcast, The Animal Welfare Junction. She is the veterinarian at the RASCLE unit in Ohio and a freelance forensic vet. So I'm going to introduce Dr. G. Welcome to the podcast. How you doing?
I'm doing great. Thank you for having me. I'm really excited to be one of your first guests, so thank you for the honor.
Pleasure.
Oh, yeah. You were super sweet because when we first announced that we were starting this podcast, you were one of the first people who reached out and you invited us to your show, which will be in a couple of weeks. But, and then we wanted to reciprocate and have you on. I thought that was really cool too, because I know that you guys are part of like that humane podcast network where you talk about all different kinds of animal welfare things, just like we do. And so I think it was really nice to have, you as a representative from that little community, reach out to us. That was really sweet. I liked it.
Yeah, and
Um,
it's well, all the podcasts about animal welfare stuff need to stick together, right? Like it's not about a competition. We all have something to promote, something to deliver, information. So I'm really excited to be, talking to you guys today.
and
Thank you.
speaking of promoting, I saw a couple photos the other day that you just got a new RV truck set up, the Rascal 4, and I saw the inside and it looks beautiful and pristine. It looks humongous.
Right.
So it's your fourth one.
Yes.
Okay, if for people who haven't seen it, what is the Rascal for?
Well, so I mean, the RASCLE unit in itself, it's a group of mobile veterinary clinics, and we take these clinics throughout the state of Ohio to provide affordable and accessible care, primarily spay neuter efforts, but then we do vaccines and we do some other things. We work with hosting groups, shelter organizations to bring the service both to shelter animals and to the community. So we try to help as many animals as we can through the state. And the best way to do this is with a mobile clinic because that way we can go to different target areas. And there are some places that need help maybe once a month, maybe 4 times a month, maybe only twice a year. So we're able to just take the truck to these areas as needed. So Rascal 4 is number 4 because it's the fourth truck that we have gotten in our fleet. We started back in 2006 with Rascal 1. And then over time, Rascal One stopped being able to go places, so we had to get other trucks. But yeah, so now we have our Rascal 4, and it's a full service as far as we have a surgery suite in the back. We have a dental machine. We have our own refrigerator. It has a generator. It powers itself. It has a water tank. So it's very self-sustaining. So we can go to different places and you know bring their services to them.
How do you figure out which areas that you want to target?
So the places that need us actually reach out to us, right? So we don't just go somewhere. We are invited. We're kind of like vampires, right? Like you got to invite us in. But but yeah, so what we do is if a hosting group has the need in their community, they reach out, they schedule, and then we just tell them what we require as far as scheduling. So we'll tell them that we need 30 what we call pack surgeries, which is going to be any kind of dog surgery or cat space, and up to 20 cat neuters. And then they can schedule based on those numbers, based on what their community needs. Because, I say, I provide the service, but I don't know what the community needs are. The hosting groups do. So we leave it up to them to tell us, we really have a need for dogs, or we have a need for cats, or we have a need for feral cats, community cats. We just tell them what we can do, and then they schedule it for us.
Who are the hosting groups?
Uh, Realistically, any shelter, humane organization, we have county facilities, county pounds, county dog shelters that do it. So it's any organized group that services the community.
My shelter has what we call like a community engagement group. So they go out into the community and they, provide vouchers for those types of things. And, they help people with resources coming into our clinics and stuff. But I had suggested this idea a while ago that they should go and do these like setups at like apartment complexes,
Mhm.
like these complexes who we have we're there all the time for calls for all kinds, loose animals, and they just are tend to be in these not as well off neighborhoods, and so access to care is a big problem. Um, so is that something that you guys think these mobile clinics like have the ability to do, that would have like some kind of benefit in like working with like whoever like the community manager is at those places?
Yeah, absolutely. We do what we call just wellness clinics, and we'll go to different locations to do vaccine clinics, microchips, and general wellness care. And so it is something that, yeah, it opens up to being able to do things like that, to target, again, like targeted care. So we'll take the units to rural areas. We'll take the units to areas that are not very affluent, that do not have services, because we see that there's a lot of people that don't take care of their animals, not because they don't want to, but because they can't, whether it be because of cost or because there isn't anything around them. So we are trying to bring them to service so that it eliminates those barriers to care.
I think like what you're referring to too is what we call in animal welfare these veterinary deserts. And so if there's no brick and mortar facility that someone can go to, if they have the means to do it, then you have the ability to just come to them and completely eliminate that. So you're planting a bunch of trees in this desert.
Yeah, no, absolutely. And we use that term as well. And a lot of the places that we travel to, especially in southern Ohio, are veterinary deserts. There's either no veterinarians, or there's not enough veterinarians for the entire community. And then there are some places that do have veterinarians, but the cost of the veterinary care is not feasible for some of the members of the community. So we are, again, bridging that gap between not being able to take care of the animals and being able to provide, at the very least, minimum care.
And how are you funded?
We are self-funded, so the RASCLE unit itself is not a nonprofit. It's just a basically a regular veterinary clinic, but it's very community oriented, right? So it works as a nonprofit. We do not generate a lot of revenue for it. But it allows us to just go everywhere. The nice thing about it being self-funded and being run as a business is that we have to be very, very careful so that we can continue to do this service. There are a lot of people that have the best intentions in mind and give everything out for free, or they do not take care of their finances, and within a few years they have to shut down. So everything is managed as a business, with the animals in mind, and their caretakers in mind, but very
It's like
business
a great
minded.
model of social enterprise, essentially.
Mhm.
Being able to generate revenue and and still provide a service and it be self-sustaining. It's a great model. And I think you're right. Over the years that you do these things, if you're, like you say, giving it away for free, you end up in a situation where it's not feasible anymore, and programs get pulled and so on and so forth. So Yeah, what a great model. What a great
Thank you.
model.
Yeah, it has to be sustainable, right? I mean, the problem is not going away anytime soon. I like to think that we are helping. We're definitely helping the individuals and we're helping some of the communities, but the problem is huge. So we have to be sustainable to be able to offer the service for many years to come.
And access to affordable veterinary care is a huge beast. There are so many different nuances to it. There's so many different factors. So I think this is why it takes so long to really understand why access to care is such a big problem, because there's so many contributing factors. And so one of the things that I've seen when people are talking about it, and it makes me feel really bad too, because people get upset that the cost of veterinary care has risen exorbitantly over the past, like, what, 10 years. I think I just saw a chart today saying that in the last 2 years, or since like 2019 or something like that, that costs on average went up like 22% or something. And I've seen other like percentages, so I don't know exactly what is accurate, but I almost feel bad for vets, because people tend to get upset and they're like, I can't afford it, like, why is it so expensive? Like, it's and it is beyond like inflation. It is so far beyond that. But I think people don't realize that it's not like these, like, vets like you and stuff that are really doing everything they possibly can to help people and help get this thing under control. So from your perspective, being a vet who provides all these services, help us unpack some of the different factors that contribute to the difficulties of access to care.
Yeah, so cost is a huge issue. And as you have mentioned, the cost of veterinary care has risen. It's like, I mean, it's ridiculous the way that it has gone. Whereas somebody could go and get general wellness care for their pets, get vaccines and prevention for probably up to about $100, to now it's like $400 or $500. It's a huge increase. And a lot of people have that mentality of, if you cannot afford a pet, you should not have it. Well, people that got pets at the beginning of this, first of all, did not realize that it was going to go that high. So there is no way to prepare for that. There are reasons why the cost of vet care has increased. I mean, we are increasing as a field. There's more things that are available. There's more education, more research, more knowledge. Dogs nowadays are getting CT scans. They're getting chemotherapy. Those are things that you never even heard of 15, 20 years ago. So the cost of care has gone up, but there has been a lack of what is called spectrum of care, which is meeting people where they're at. So you may have a dog that has a problem and it needs a treatment, and a lot of veterinarians are going straight to what they consider gold standard of care. And I hate that phrase because it makes people feel that if they cannot do gold standard of care, then they're just crap owners, right? So spectrum of care is meeting people where they're at, is saying these are the options that we have available, and these options are more expensive, and these are the benefits of it. These are not as expensive. These are the risks and benefits of that, and then trying to do what's best. Um, I think that in our business model, we have chosen to see more patients and do more work. And then because we have a higher volume, we can charge less. So veterinarians that can only do 5, 6, 7 procedures in a day, realistically, they cannot charge what we charge, right? Because they would have to shut down. They need to pay their staff, they need to pay their overhead. So we just manage everything very, very carefully so that we can offer this lower cost service to the community. Now, there are benefits of going to a full service clinic compared to going to somewhere like us. We cannot provide long term care. We cannot provide hospitalization. We cannot provide all the full benefits of a regular clinic. So there are some limitations of what we can do, but we are able to provide something to the majority of people that are in need. As far as the whole access to care is, when we discuss about these deserts, there's the lack of veterinarians, but you may even not be in a desert and still have no access to care, because we forget about the people that cannot travel. We can have individuals that are elderly, people that have disabilities, that they don't have a vehicle, that the clinic may only be a mile away, but you're not walking with your dog for a mile, right? So access to care has a lot of different things. And then there's the education bit. Sometimes people don't understand what it takes to take care of their animal, or when do I need to take my animal in, what is the importance of spay and neuter, what is the importance of vaccinations. So education also plays a pretty big part in access to care.
I think one of the confusing things that I've heard in my duties, out in the public, a lot of times what people are saying often conflicts with what the law says. So, for example, where I am, the law is that the dog or cat has to be spayed or neutered when they turn 6 months old. And, it's not uncommon where people say, well, I've already talked to my vet, or I've already talked to my breeder, and they told me I need to wait, a year or 2 years, depending on whatever the breed is. And it's really difficult to have a conversation with them because I'm not a vet. I can't tell them, what, and I really don't want to try to go up against like a vet's word about when they should wait to spay or neuter. All I can tell them is this is the law, this is what it says. We have to enforce it. I can tell you all the reasons why spaying and neutering is good, avoiding cancer and all of these other things and mammary tumors and such, but I don't have the ability to really back that because I'm not a vet. So I can't, it's harder to fight that logic with people. So, since you are a vet, I would like to ask, why do some vets tell people that when I feel like pretty much everybody knows that there is a severe overpopulation crisis? Like, why would there be vets out there telling people like you should wait until they're a year or 2 years or whatever age?
So a big part of that is a study that came out of University of Davis about the age for sterilization. And what they're doing is trying to correlate the sterilization age to problems that happen, like health problems. And so what their research has told them, or what they have gathered from this research, is that waiting until animals are at least 18 months to get them fixed decreases the risks of some potential problems, some of those being orthopedic problems, and some of them being cancers. Now, in my opinion, and it's not just my opinion, it's the opinion of many, the research is very biased because they are taking a population, a sample of animals that are going to a referral facility. So it's going to be very, how do you say, not every animal that has an orthopedic problem is going to show up at their door. Is going to be more the affluent people that can afford to pay five, six, $7,000 for a procedure. So the sampling is not very good. And one of the things that they say is like, if you spay your dog early, it's going to die of cancer. Well, maybe it's dying of cancer because it's living longer, right? Like you have to die of something. Whereas if
Mhm.
you're not sterilized, you may be dying of a pyometra, of a uterine infection. You may be dying of other problems of other types of cancers. So I really, really dislike the research. Me personally, if it's between I spay my dog early and it may blow its knee, or I wait too late and it dies of cancer, I can repair the knee. Cancer is a lot more, it's life threatening. So that is the whole thing behind the whole, wait until 18 months. It's supposed to be like they're better developed, their bones are better developed. My personal animals, they have all been fixed before 6 months of age. I've had two Great Danes. One lived to be 13 years old, the other one lived to be about 11. Both of them died of cancer. However, how many Great Danes are 13 years old walking around? Not many, right? And they didn't have any orthopedic problems up to that point. So there are a lot of issues with the research. One of my biggest pet peeves is that there are not a lot of veterinarians willing to spay and neuter dogs over about 60 pounds. Right? It gets very difficult, and also it gets expensive to to fix these animals that are that big. But we're telling people you have to wait until your dog is fully grown, and then they get to be 18 months, and you take the Great Danes or the Mastiffs or Pyrenees, and now here's a 120-pound dog. You bring it back to the vet and they're like, well, It's too big. We can't do it. What are we doing? And plus, these big dogs are the ones that have the huge litters, right? Like, these are
Mhm.
the dogs that have 8, 10, 12 puppies. So we are encouraging the breeding of dogs, you know, even if the person did not mean to get them fixed, just the accidental breeding of animals that have huge litters that then end up in shelters that are very difficult to adopt out. Me personally, I recommend for people to get their animals fixed by 6 months. Between 4 and 6 months tends to be my personal recommendation. The reason 4 months is that by that time they should have had all of their vaccinations, all their puppy and kitten vaccinations, so their immune system is as best as possible. And then by 6 months is when they start going into heat. And even kittens can get pregnant by then. So, you know, getting them done within 4 to 6 months is our recommendation.
Yeah, I remember listening to, I think you talked to Dr. Jeff, and he was like, man, they're like 4 weeks, boom. Like, I would do them as
I
soon
know
as
it.
possible.
Yes.
Like, and I'm not a vet, so I can't say. But I mean, it's like that's a big problem. And like, as much as we have made all these initiatives and we have all of these traveling vets and we have all of these rascal forests driving around, and we have all of these vouchers and all of these efforts, and we're still drowning. We're still so far underwater. It seems like we are never going to get out of this. Like, so I know, like, I'm pretty pessimistic. Is but uh I mean, do you ever feel that way? Like, is this ever going to end? Is there anything that we can do more to ban shelters and vets and community engagement teams and the public, and just, is there a way that we can get people to get more so on the same page, uh, regardless of whatever institution that they work with or for, so that we can kind of expedite this and get this more under control? Because, in my thinking, spay neuter is the key to this entire thing. Hey, that's my question. I have more questions, but I'll stop because I will keep going on. Jacob's just sitting there, just like, I know this lady talks too much.
No, you
I get
don't.
carried away.
No, I mean it is kind of frustrating, but I do think that we are making an impact, right? The problem is that overpopulation is huge. You know, we've let this problem get out of control. So it didn't get out of control overnight, and it's not going to get fixed overnight. So it takes, as you mentioned, everybody coming together. I can spay and neuter all these animals, but without the help of the community, without the help of animal control, without the help of the shelters, there's nothing I can really do, right? Everybody has to come together. So I think that the veterinary shortage is a big problem, is a big part of it. There's not enough veterinarians to service all the places. That's why we have so many veterinary deserts. So trying to figure out ways to encourage veterinarians to go to these deserts. Not every veterinarian is trained in high volume sterilization. So you cannot expect every veterinarian to crank out more than 10 surgeries in a day. Like we do between 30 and 50 surgeries in a day. That's not common. So getting veterinarians to learn how to do things like this. I'm a board member of United Spay Alliance, and one of the things that we're working is on ways to help train people on both being able to do more surgeries per day in a high quality way, because that's the other thing that I want to make sure that people understand. We're not doing all these surgeries by cutting corners. We're doing all these surgeries by using efficient methods that actually are better for the patient. The patient's under anesthesia for a shorter period of time. They do not get as cold. They have a lower risk of infection. It's just a safer environment altogether. So, looking for ways to empower veterinarians to be able to offer these services. And then another thing that we are doing at RASCLE is we have a mentorship program for veterinary students. So we are taking students before they even graduate and teaching them these techniques. So when they graduate, they can go into shelter med, but they can, even if they go into general practice, they can still take a day, a few days in a month and go to different locations and offer these services. It's really a numbers game, and it's about being able to target places, finding out where the problem places are, going there and fixing as many animals as we can in a short period of time. I tell people, if we were just fixing one animal in each county every day, we're never going to fix the problem, right? Because there's still too many out there that are still reproducing. But if we go to one place and fix a lot of animals at the same time, again, a targeted effort, that makes a difference. That's actually going to control the issue at that location.
I didn't know for a long time that when vets came out of school that sometimes you graduate only ever having done one spay or neuter, or and there's this kind of assumption that vets come out and you can do all these things and you can do all these really complicated surgeries and you're just like bam 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 bam. And it's just it's like with doctors too. It takes time and it takes practice and it takes experience, and like fostering those relationships with those vets and those interns, like who are in there still, and getting them set up for success, whether they end up coming and like working for you or working in a clinic, or opening their own clinic, working at a shelter. I think that's really cool, and I think that is kind of like in line with this, with the like the undertone of what this whole spay neuter movement, I guess, should is that it takes a lot of collaboration. There are a lot of stakeholders involved, and everybody really needs to be like on the same like on the same page of this is the way that we get out of this. And that was what I was going to say before, is that um, there are so many problems with animal welfare right now. People don't have affordable housing, and if they do, they either aren't allowed to have dogs and cats there, or it'll be pet friendly, where you have to pay pet rent and a deposit and all of this, and like people don't have that money. No, like nobody has that money. So I think all of these things that you guys are doing to like try and help people out, it all makes a difference. It all has an impact, and it really takes like cooperation from everybody to get there.
Yeah, no, absolutely. And we talk about the people that cannot do well for their animals. If you think about it, somebody that loves their animal a lot and their animal has whatever disease or condition, if they cannot afford it, what are they going to do? They're going to try to surrender it so that it can hopefully find care. Well, how about we decrease pet population going into shelters by keeping these animals in their homes in a responsible way? Like, I'm not for the, you know, deny intake. It's more, let's find out why they're surrendered, and see if there's something that we can do to keep them in their home with their pet owners. If it's a matter of, again, like it may just need some antibiotics, it may just need some like behavior recommendations, it may need some things that the person is willing and able to work with. They just didn't have the resources, so we just need to, again, educate and give resources. And that's a great way of keeping animals from going to shelters.
Can you tell us a bit more about your forensic work that you have done or are doing, or
Yeah, so
so on?
I love forensics. It's I grew up wanting to be kind of like a CSI type person before there was CSI on TV, and but I really wanted to be a vet, so I became a vet. And then University of Florida came out with a forensics program, and I was like, this is perfection, right? Like this was made for me. So I do different things with the forensics. I work with national organizations like HSUS. We'll go to different locations to
Okay.
investigate dog fighting, to investigate hoarding, puppy mills. And my part as a veterinarian is I go there, I do the walkthroughs with them, I evaluate the conditions of the animals and the area, the places where these animals are kept. I then examine the animals and create a report to see, does is this neglect, is this abuse, what needs to be done, and then their team takes it from there with local law enforcement to press charges if that's the way that needs to go. from a lower scale, like we'll work with local hoarders, but not everything that is neglect is a it well it's kind of tricky wording. Like I'm going to say, not everything that's neglect is a crime. Like animal neglect and animal abuse is a crime, but why are people doing these things, right? So I believe that there's unintentional neglect, that people don't want to do it. They do it because they can't, they don't have resources or whatever. And those are things that we can potentially do something about.
I like the fact that you have that two pronged approach. Because on one side you've got that community outreach, where you can actually prevent these issues in the first place from becoming
Mhm.
criminal matters and ending up taking up court's time, ending up separating animals from their homes when actually that may not be the best option. And of course the stress on the person who is going through this, perhaps hard times. So I really like the fact that you've got those two together. It's kind of interesting because it's not all just about prosecution, prosecution,
Right.
prosecution. It's given that holistic approach, which is great. Yeah, brilliant. How long have you been doing the forensic work?
The forensic work since about 2017, so it's been about 7 years or
Oh,
so since I started doing that, and I really enjoy it. I like, if somebody's a criminal and is doing bad stuff, I enjoy putting them in jail. But if it's somebody that needs
So
just a
do
little
we.
bit of education, then
really?
yeah, let's
Yeah.
let's educate you, um,
Yeah, no,
because
I
yeah.
think I think you're right about that distinction.
Mhm,
I mean, I don't really deal with neglect. I think that Ray perhaps probably does, but I don't. I deal with organized crime, and so for me, it's just lock them up and
mhm.
preferably throw away the key. But and having forensic veterinarians it's just invaluable. I mean, I go to them all the time saying, "Can you just tell me what this scarring may be consistent with? Can you tell me what this is? Can you tell me what that is?" And they're brilliant. I mean, it's without you guys. I mean, we just would not be able to do it. So it's such an important piece in this puzzle. So yeah, I admire it a lot, and the University of Florida looks like they're doing really good things.
Yeah, they're doing great. Like their whole forensic department, Dr. Stern. I
Fab
just
guy,
met with him.
fantastic.
Yeah, he's amazing. He's very knowledgeable, and his whole team. I mean, they just have a really solid group of people that are very knowledgeable in forensics, and they're advancing the field of forensics. It's not just doing examinations and writing reports. They're doing all of these, DNA analysis and toxicology, entomology. It's really amazing what they're doing.
We ended up both joining the International Forensic, or what is it? The International
In
Society of Forensic
Animal forensics.
Animal.
animal science. Hmm.
Yeah.
Yeah, yeah.
Yep. I don't know. It's a long word. Okay, words are hard. But we joined it. It's cool. And he's going to be on. He is going to be on. Later. So I don't want to
We'll be here.
get. I don't want to spoil too much stuff for him. But I do want to. I do want to ask you, Dr. G, what I'm seeing more often now is these cases of neglect that are actually persisting for so long that they're tipping and spilling into cruelty, where they're so severe, and owners have they're aware of whatever the issue is. Maybe they have gone to a vet that says you need to do this is the spectrum care ABC, and they just simply they can't afford anything. And then animal just sits there, and it just sits there, and it gets worse and worse and worse. So they're aware that there is a problem, and that it's causing pain, it's causing discomfort, and it's going to lead to all of these things because either that vet told them, or that animal control officer told them, or maybe like a tech who is a family member or a friend or something. So they're aware of this stuff. So it takes us from neglect, which is something we typically look at as a lack of something to provide. It is it is an omission of something, which is usually food, water, shelter, veterinary care, depending on what your local ordinance says. But when that's kind of like the withholding of those things, but and then cruelty on the other side is more so with intent, and you have the mens rea behind it. You know what you're doing, it is very intentional. So there's this overlap that is happening more that I'm seeing with the cases I handle, that they're like, oh, I took Fluffy to go see the vet about like this matting and stuff, and they said that this was what was going to happen if we didn't, clip and clean this wound, and now it's horribly infected and there's a bunch of maggots in it, and they told me that would happen, but it didn't. You now are, I'm issuing cruelty and neglect charges simultaneously more often. Are you seeing that kind of thing too?
Yeah, so as a veterinarian, especially working in rural areas and in poverty-stricken areas, we see a lot of neglect. And I often say how in any other circumstance, I would be looking for the humane officer to be pressing charges against some of the animals that I'm seeing because of the state the animals have been in. I can tell that these are chronic problems, chronic skin infections, ear infections, the nails are overgrown. So that's where the education bit happens. Are these animals being neglected? Yes. Why are they being neglected? Is the person just not caring, or is the person not able? And if the person's not able, can we give them the ability to care for their animal? So if we can educate and we can provide services and we can see that that person is improving the quality of life of the animal, then I'm all for doing that. It's still neglect and it is still abuse. I mean, your pet has a problem that you're not taking care of. It doesn't matter what the reason is, you're still not taking care of it. But we can prevent neglect by providing these things. I actually recently, well, last year, we dealt with an animal hoarder who fits everything about hoarding except the house is immaculate. It's very nice, it's very clean. They have over 80 cats inside of a small house, 3 people living in it. And in the place where the county where they live, there are no regulations as far as the number of animals that they're allowed to have. So at that point, neglect is defined by the quality of life of the animals, right? As you mentioned, do they have food, water, shelter, etc.? Well, those animals, everything is being served. So when I went there, my evaluation was, what can I do to improve these conditions? Clearly, the biggest problem was going to be spay neuter because they did not plan on having that many animals. Cats breed very quickly; they'll have very litters, and so they went from, all of a sudden they go from 4 to 30 to 80 cats in a year and a half span, and they didn't want to get rid of the animals because they are hoarders. So we went to the house and we spayed and neutered all the animals that they had in the house. So we spayed and neutered every single cat that they had. We gave them vaccinations, and they were overall in very good condition health wise. So by providing that access and affordable care, we helped deliver service to that house for something that, by all intents and purposes, would be considered cruelty and neglect through animal hoarding, right? So, because the way that I think about it too is, let's say I go in there and I remove these 80 cats from that house. Where am I going to take them? The shelters are full.
Yep,
What am I going to
exactly.
do? Put them in a shelter, euthanize them, set them
if
out?
if that shelter will take them and say, well, we're full,
Mhm.
so you got to go down to your local open admission one down the street, if it's
Right.
close enough.
No, exactly. And then, am I really doing a service to the cats by removing them from that situation? Because the cats are actually in a clean environment. They're loose. They have people who love them, who pay attention to them. I'm going to take these cats and now all of a sudden put them in cages and take them into a shelter. A shelter. Yeah, I'm not trying to say that shelters are horrible places, but a shelter is not a long-term living for any animal. It's supposed to be a short-term environment to keep them safe while they go from point A to point B. So why
Mhm.
am I going to take these cats and do that to them? So if we can provide affordable and accessible care and keep animals in a safe manner, in a healthy manner with their owners, then I feel that we have to, and in the end, it's going to help the shelter overcrowding problem that we're having.
something that I mean, I'm not involved in this, but I know others that are. Something in the UK that's very common is the use of improvement notices, and it's very, very common, and RSPCA inspectors issue them all the time, and they're a great way to address minor issues from becoming major issues, and also allowing animals to stay in the home rather than be removed, because these people, like you say, are not intentionally cruel. I mean, the people I deal with, for example, dog fighters, you wouldn't want them to own a dog ever in their life or step foot anywhere near any animal.
Right.
But
Yeah.
that's not the typical. The people that we're talking about, are not those sorts of people. And actually, the UK does this improvement notice, and it's a great system. It works really well. It is, however, interesting because in the UK, Animal Welfare Act offences, so cruelty offences, we don't have to prove mens rea. Or there's a limited element of proof of it. So just the mere failure to act would be treated as the same as if I kicked it, for example. It would be treated exactly the same. And I think when you've then got the penalty of 5 years imprisonment to back that up, I think that you should be very mindful of the cases that you're taking to court.
Right.
I'm not saying that people get those penalties even when it's justly deserved, but the risk is still there. And so yeah, I think it's kind of interesting to hear your viewpoint on that. And like I said earlier, I love that holistic approach of being able to combine the two. And I think often the public don't understand, and this is a shame, or this is what I hear from others. The public doesn't really understand, when you're trying to work with somebody, over a period of time, they get frustrated. And whilst we feel their frustration, actually, this could be the best thing for the animal.
Right. And we have to remember about the human animal bond, right? So the animal may be suffering because it has an ear infection, skin infection, and all that stuff, but those people are bonded to that animal. So they're not going to want to get rid of it. They're not going to want to put him down. Like, why am I going to kill my dog because it has a skin infection? So we have to understand the importance of the human animal bond in making these decisions and evaluating why people are neglecting their animals, because these animals with these horrible skins and horrible ears and horrible teeth and all that stuff, they're sleeping in their beds. They're eating out of their plates. Like, they are bonded with them. So we have to take all of that into consideration when we're thinking about the whys. The other part of it is having a one health approach to it, because that person who is not taking care of the animal is most likely not being able to take care of themselves. So what can we do to help this person take care of themselves better, improve their quality of life, so that then by default they can take better care of their animal? And that's where, again, it goes into, it's not just the vet, it's not just animal control. Now we're involving all different agencies into it, helping these people, take care of themselves and take care of their animals, just improving the overall quality of life of everybody involved.
There is something that I wanted to talk about specifically with you, is about the topic of dental care. And because it's so, like, sometimes it's very difficult for animal control officers to investigate that. And even if their agency is willing to let them cite for, just poor dental care, it's a hard topic. It's not as cut and dry as you have a broken bone, like that's obvious, like your leg is sticking out. But dental care is different. It's a whole different beast. And there's an argument that, well, because people, like, a lot of people don't get dental care, like, why should the dog, if it's not causing any kind of like significant problems, then why does it matter? And it's my understanding that the that a dog or cat's mouth and the health of their mouth is directly correlated to almost every single organ function uh, in their body. So taking care of their mouth is really important. So I'm just wondering, like, what your thoughts are on the importance of dental care and the things that you see when it comes to things that start to like tip into like neglect and stuff.
Yeah, so dental care for me is of utmost importance, especially, and I'm not talking about dog has a little bit of tartar, has a little bit of redness in the gums. I'm
Right.
talking about these dogs that the mouth reeks because you open their gums, you pull up their gums, and their teeth just have pus coming out of them. The teeth are loose, they're losing teeth. And the problem with that is that people don't understand the pain and suffering that the animals are going through when they have these problems, because dogs and cats do not tell you when something hurts, right? And for them to stop eating because of dental disease, it takes a lot. So we feel pity for ourselves. If we have a bad tooth, we're telling everybody like, "Oh, my tooth hurts. I need some Advil," and like we're eating out of the side of the mouth or whatever. Animals are eating for survival, so they're going to keep doing what they need to do, and they're going to push through to do what they need to get done. So by the time an animal with bad dental health is not eating, that is so severe that that is just it's cruelty. So one of the issues that we see is that there are different barriers for people to be able to get dental care for their animals. A big one is cost. The cost of animal dental care has grown exponentially. So it's not rare to see veterinary clinics that require just $1,000 just for a cleaning, and then it goes up from there for extractions and antibiotics and everything else. So we do need to train more veterinarians in how to do these procedures at a lower cost. We do a large number of dentals at our facility, and we cannot keep up with the demand for dental care from the patients that we see. And if you do some of these procedures and get all those abscess teeth removed, and then talk to the clients afterwards, you start to learn the importance of it. These clients come back and say, "Oh my God, I didn't realize that the mouth was hurting us so bad. This is a different dog. It's so happy. It's playing. It's doing this. It's chewing on bones. My dog has no teeth now, and it's trying to chew on bones." So it makes a huge difference to just how they feel in general. And then, to your point, as far as the health overall, the bacteria in the mouth, it has direct access to the circulatory system. So that bacteria can get into their heart, affect their valves. It can get into their kidneys. It can cause urinary tract infections and kidney infections. We see a large number of dogs, of female dogs with pyometras, with urinary infections, that also have severe mouth infections. So there can be a correlation there as well. So keeping the mouth healthy is important to everything. People get concerned because, as opposed to, we go to the dentist and we sit there with our mouth open and do whatever they tell us to do, and animals have to be put under anesthesia. And you know, pet owners get concerned about the risk of anesthesia. I tell them the risk of anesthesia is existent. So I'm not going to say that there is no risk. However, the risk of doing nothing is worse, because for sure something bad is going to happen down the road. So yeah, when I am doing cruelty investigations, I do pay attention to the teeth, and that is something that I will write down. If there is severe dental disease, it will be one of the things that I ask for charges on.
When I first adopted one of my dogs from a shelter years pre-COVID, um, that kind of same thing ended up happening, where she was seemed fine, and she eventually stopped eating, where we had to wean her down and give her tuna, and we didn't feed her people food, but she would not eat, and she would eat some people food at first, and then just not at all. And I was very, very lucky that I actually worked as a veterinary technician at a one doctor, clinic. At that time, I had two full-time jobs. And the cost for removing what we found once she was under, her mandible had gotten so bad. One of her teeth had broken off, the gum line had healed over, and it got so bad and so infected that it actually started to wear away the jaw bone, and it was just rotting. And eventually, he said it would have just broken in half, and it ended up spiking her liver, her ALTs more than twice the highest allotted amount. And it was like, she will die if not, if you don't treat this, she will die. And like I know what it feels like to be in the position of people who can't afford something like that, because the bill that I would have had to pay was like $2,200, and I was not making a lot of money. There was no way I could afford it. So I would be in that position had I not worked for the clinic and got an amazing, price off of it. I would have been in that position where it was either I would have to surrender her back to the shelter that I just adopted her from, that I work at, or I would have to euthanize her for something that wasn't her fault. And before there's any judgment from anybody on their end, it's not like I had this dog for a long time. I had just adopted her a couple months ago, and she came that way from her previous owners who had not fixed that broken tooth initially when it happened. So I was not neglecting her. I just want to make sure that that is very clear. I didn't have her for many years. She just came that way. But it's a problem, right? So that for me was a very personal experience, and why when I am talking to people about these cases and trying to help them with finding resources and stuff, I get it. I get why it's so expensive, because you are put in this horrible position. If you can't afford it, what do I do? Euthanize my dog? Or do I just give her up and hopefully the shelter takes care of it? That's a
Yeah.
crappy position to be in.
Right. And to do that over something that is treatable and curable, right? So it's something that in a few hours can be taken care of, and then you can have a happy, healthy pet after that. So that's why our dental pricing, it's nowhere as high as it should be, because I mean, we try to keep everything again like low cost so that people can afford it. Our pricing for dentals range between $75 and $250. So a $250 dental is one where you need extractions and they need antibiotics and they need pain medication and that kind of stuff. And still, there are people that struggle to come up with $250 to pay for a dental procedure. But the reason why we don't charge a lot is because it is very necessary, and animals should not have to suffer because their teeth are bad because the owner cannot afford over $1,000 to take care of their teeth. And I'm not we are limited in what our dental services are. So I'm not saying that our $200 dental is the same as the $1,000 dental that you're getting at your veterinarian. There are differences. However, for the people that cannot afford that, this is way better than nothing. It's not even like this is better than nothing. No, this is a lot better than doing nothing.
Mhm. How important is it to have like post-op radiographs done after extractions?
So I think if it's something that you can have done, it is very of great benefit, because then you can look and make sure that there are no broken tooth roots or anything like that. We personally, we do not have x-rays because we cannot have the equipment, and we do not have the funds to be able to do that with the cost that we are charging. So we let people know we're not doing x-rays. So if there's a tooth that has been broken that we cannot see from the outside the problem, we may not be able to address it. If we remove a tooth that has a broken crown, or that the crown is fractured and has a broken root, we may not be able to address that. We may not be able to do all types of extractions. So we let people know these are the limitations of what we have to offer. If we get a patient where we feel that x-rays have to be done, again, we'll do what we can, but we will tell them this is what you need to do, and then given that option. But in reality, it's very few the ones that we cannot offer some kind of relief. The majority of them, we can do something to make them feel better.
Well, um, Dr. G, I really appreciate you coming on to our podcast, for reaching out
Yeah,
and,
thank you.
and talking about just access to care, and just like access to care in spay neuter, and how critically important they are to helping us, with this crisis, and helping animals and helping people. What before we end, is there anything else that you wanted to cover, or are there any points that you think uh, would help people listening to this know, like, these are the most important things that you should do either for your own pets or for people that you are talking with and working with in the community?
I think the biggest thing is that we're all in this together. So people need to stop bickering and fighting and bitching at each other about what, one person does and one person doesn't, because we all have things that we can offer. And there are some people that can do better than others, and that's okay. So everybody needs to work together. There are resources out there. We just have to find them and we have to make them accessible. So we need to, get out of our own egos and do it for the animals, and put all our heads together so that we can get stuff done. It is possible. We just got to get it done.
Just one last thing, question from me was, I know that we have quite a few animal control officers and investigators listening to this podcast. So I'd just be interested, do you have a few words, for them about getting it right in terms of working with veterinarians like you, or, just that, any tips and hints that you've got?
Yeah, I love working with animal cruelty investigators, and I tell them that the best time to reach out to me is before they even go on the scene, right? Because it's really important to make sure that you're getting all the information that I need to help build your case, right? It's your case. You're ultimately the one that's going to be doing something about this. So reaching out to veterinarians, giving the veterinarians what they need, collaborating, working together, so that so that everything can get done. There are a lot of things as a humane officer. You know all the legal stuff, but you may not know what you're looking for in a particular dog, or based on the case, what evidence you need to collect. So working with a veterinarian to get all that information done is super valuable.
Thank you so
It's
much.
kind of something I refer to as like the golden triangle. So you have like your animal control officer, you got your vet, and your prosecutor. And if you can get everybody to come together beautifully, like you're gonna have a beautiful case.
Yes, absolutely.
All right.
Thank you
Well,
so much.
thanks, Dr. G. We appreciate it. And thanks to all of our listeners for tuning in and joining us on this. Be sure to check us out on LinkedIn, YouTube, and Spotify.
Thank you so much for having me. This was great.
You're welcome. You're very welcome. We're gonna see you. We're gonna see you on yours in a couple weeks.
It
So,
was a
Excellent.
pleasure.
all right.